I'm sharing a screen now that says Navigating Medicare in 2025, your essential guide to upcoming changes.
Looking good.
Okay, so a couple things that we're going to talk about tonight is we're going to do a quick review of Medicare and how you can get your Medicare either through a Medicare supplement or Advantage plan. Um, and then we're going to talk about changes for Medicare to look for in 2025. And then we'll end with the next steps on where to go from here. So Medicare consists of two parts A and parts B that make up original Medicare. Um, Original Medicare will pay for 80% of your medical expenses, and then you are responsible for the other 20%. There's no prescription drug coverage with original Medicare, but there's also no network of doctor, or we'll get into that with so a Medigap or a Medicare supplement is how some people choose to deal with that 20% that they're responsible for. A Medigap plan has a monthly premium that you pay, but in return, and that 20% is paid for in full um, to your provider. There's no prior authorization that's needed with a Medigap plan. There's no networks, but so the only thing that you really need is a Part D plan to go along with it to help pay for your prescription drugs. The other way that you can receive your Medicare is through a Medicare Advantage plan or a Part C plan. How that works is that a private insurance company takes over your original Medicare. Medicare will pay that insurance company somewhere around $1,000 a month for you, but then you are responsible for deductibles, co-pays, and co-insurance. Sometimes you can also have a monthly premium to go along with it. Medicare Advantage plans also require prior authorization for some services, and a recent study found that around 13% of prior authorization claims are denied. Other advantages with a Medicare Advantage plan are over-the-counter benefits, gym memberships, dental coverage, and things like that. But every Medicare Advantage plan is different, so the details of your plan might not be the same as what your friend or neighbor has. Medicare has different enrollment periods. The enrollment period that we brought you all here to talk to you about tonight is the annual enrollment period. That starts on October 15th and it runs through December 7th. And we can start meeting with people on October 1st. So any plans or changes that you make to your Medicare during this time are effective on January 1st of 2025. In the new year, there is another open enrollment period where you can make a change to your Medicare Advantage plan, but that's only to change. You can't add Medicare Advantage at that time. There's also initial enrollment periods when people first become eligible for Medicare. And just because we have you all here, we want to also remind you that there are special election periods. These aren't very common, but some of the most common ones are if you move out of a covered area, if you are diagnosed with a chronic disease, or if you become eligible for extra help. So the changes to Medicare in 2025, we anticipate that there will be a lot of changes and that everyone will pretty much be affected by it, whether you have a Medigap plan or Medicare Advantage, we're going to be seeing some changes. So it's more important now than ever that we talk with you during AEP. So what is causing all of this change? The Inflation Reduction Act, which was signed into law in 2022, there's been phases over the last several years. So in 2023, we saw that if there was a recommended vaccine, everyone was able to go and get that vaccine for free. And if you are diabetic and were needed insulin, that monthly cost was capped at $35. In 2024, there was a small shift in how certain coverage took place during the catastrophic phase of prescription drug plans. But in 2025, we're going to be seeing the biggest changes. So there's going to be setting a $2,000 annual out-of-pocket maximum. The the $2,000 out-of-pocket limit includes amounts paid during the deductible phase and the initial coverage phase. Other changes are an elimination of the coverage gap or the donut hole. The coverage gap phase was especially difficult for individuals with high prescription drug costs, as there was a drop in the amount of coverage that individuals reached a catastrophic level of coverage, or until individuals reached it. There's going to be a new Medicare prescription payment plan program that's being implemented. And the way that this plan will work is it allows enrollees to pay for prescription drugs in monthly installments instead of paying large lump sums for their expensive medications. This will be especially helpful for those who will reach the $2,000 catastrophic limit because it allows the cost to be spread out over the entire year. This is something that you have to opt into. Participating in the Medicare prescription payment plan will require coordination with your insurance plan and your pharmacy. So we're going to talk about it more in a moment, and I'll provide an example of how it might work, but it is something that is going to be administered by your insurance plan. And we just really want people to have this on their radar so they're familiar with it. They know that, in the new year, if they want to be a part of this, they need to contact their insurance plan and coordinate this so that the insurance plan can coordinate it with your pharmacy. Other things that were changed is an establishment of a discount program that requires participating manufacturers to provide discounts on applicable drugs in the initial coverage and catastrophic phases, and changes in the shared cost sharing among enrollees, plans, manufacturers, and CMS. So this graph or chart here kind of shows the difference in how prescription drug coverage worked in 2024 versus how it's going to work in 2025. So just so we're all familiar with how these terms here, the deductible phase is what you pay before your plan will pay anything. It could be a good time during, that first time that you go to the pharmacy in 2025 and your plan's not working yet, not paying yet for your prescription drugs, that could be a good time to opt into this Medicare payment plan, because that will give you the full year to spread those payments out over, especially if you plan on reaching that $2,000 catastrophic level. The initial coverage phase is when your plan starts to kick in and cover the cost of your prescription drugs. During the initial coverage phase, you either pay a copay or co-insurance to get your drugs. There is this coverage gap phase here in green, which is called the donut hole. The coverage gap, and it's going away, is a period when your insurance would not pay for your prescriptions until you had paid enough into it that you had reached a catastrophic level. So the catastrophic phase, which for 2025 will be $2,000, is when you no longer have to pay for your prescription drugs. A couple other things to know about this is not all plans have deductibles. This chart here does not include low income subsidies. Cost is shifting from consumer for the coverage gap to the insurance carrier. So, and also in some parts to drug manufacturers. The idea behind it is that it's lifting some of those costs off of you and allowing you to spread it out over the course of the year. So the Medicare prescription payment plan program, I'm going to provide a little bit more detail about it here. So in 2025, all Medicare prescription drug plans, so both standalone Part D, PDP plans, and Medicare Advantage plans that have prescription drug coverage, they're called MAPD plans, are required to offer Part D enrollees the option to pay out-of-pocket prescription drug cost in the form of capped monthly payments instead of all at once to the pharmacy under the Medicare prescription payment plan. A client can opt in at any time to set up monthly payments. You must opt in each year that you want to participate in it. So if you have low drug costs that and you're not going to, based on that, reach the $2,000 level, it might not be something that you want to participate in. But an example that they give is Joe picks up drugs at the pharmacy in January. The pharmacy says it will cost $850. Joe can say no and still get his prescription. The pharmacy notifies the carrier. The carrier will take the $2,000, divide it by 12 months, and he will be billed roughly $167 a month. We are not anticipating that you'll be able to go and do that on January 1st, especially if you don't try to coordinate this with your plan beforehand. So we're really suggesting that in January, you contact your prescription drug insurance if this is something that you want to participate in and ask how to best coordinate this with your pharmacy.
And Jordan, there's no interest in that.
That is correct. There is no interest. Um, so, and because you want to make sure that the pharmacies are receiving that information from your plan, we would also recommend that you contact your pharmacy and say that this is something that you've talked with your insurance about and that you want to participate in, just so everyone is on the same page when you're going in to pick up your drugs for the first time in the new year, so that you're not stuck waiting there longer than you already probably need to be. Oh, went too far. So, what can all these changes mean? One thing that we're anticipating is higher premiums for standalone prescription drug plans, fewer prescription drug plans available, so that some plans will be eliminated. And also, there are some plans that are going to be non-commissionable for agents, meaning that they're going to stop paying commissions. And my dad will go into that a little bit later. But other changes will be stricter formularies. And this is a great reason why we want to set up time to talk with you. Stricter formularies can mean that some drugs will either be dropped from a plan's formulary or the drugs can be moved from one tier to another tier. So we want to review that with you beforehand so that you're not caught off guard in the new year that your drugs aren't covered the exact same way that they were covered in 2024. Another thing that we could expect is more drug utilization reviews. Those are things like step therapy and quantity limits. Um, because this is such a wide sweeping thing, it affects MA plans and MAPD plans. We could see reduced benefits on Medicare Advantage plans, including higher copays and less supplemental benefits such as dental and over-the-counter, those OTC cards that you can get. So it's just all of this is why this year we really want to do a Medicare review with you, and you really should. For those with a Medigap plan or a Medicare supplement, we're not anticipating change in the plans themselves because they are still going to be responsible for that 20%. Um, and those plans are standardized, so they all cover the same thing. But what's different about them is how they calculate their premiums. And we're anticipating that premiums are going to go up. So that coupled with changes in prescription drug premiums, we really want to go over that with you so that you're prepared going into 2025 as to what that can look like. So now what? First is that we're here for you and we can schedule an appointment starting on October 1 and you can give us a call 810-209-4800 or go to our website dougmcculloughinsurance.com. You can book an appointment online right there through it.